Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello everybody! So today on this weekend we have a special guest. She's Dr. Shirley MIRPURI. Yeah, so she's all the way in Singapore. She was actually my naturopath doctor in Singapore, and she also was the naturopath doctor of many of my clients. So we have been working together for the past 3 years, and today we decided to work in these episodes talking about certain diseases that is affecting the population. And actually today we're going to be talking about a fungus disease that affects a lot of women out there, and even men too. And it's candidiasis. And this is something that has affecting many of my clients, and I learned through Dr. Shirley MIRPURI a lot of symptoms and how to cure and how to heal this fungus infection. So, Dr. Shirley, how are you there?
Hi, good. How are you?
Super good. I'm here in Toronto, and it's Sunday morning. We have 12 hours of difference, so you're already on the night, and we are here in the morning. And so far, it's good. It's a beautiful Sunday. How was your Sunday there?
It's really good. It didn't rain today, so the weather's pretty perfect.
Yes.
We all missed you in Singapore.
True. Singapore is like
Yeah.
weather is just either rainy or dry, pretty much.
Yeah, pretty much, yeah.
Nice. Well, yes, I miss you too, but it's good that we still keep in contact. And these episodes, we're gonna be talking about many topics that can affect the body, and Candida is something that is being kind of out there, right? Like it's been affecting more and more and more. So could you just tell us about first, what do you do there? Like you are a naturopath doctor, and if you can tell us what's a naturopath doctor.
Sure. So I did my training in naturopathic medicine in Toronto, actually. There's only a few accredited schools within North America that actually teaches naturopathic medicine. So what it is basically is we're basically trying to get down to the root causes of what's happening with you and why you have certain symptoms. So as we see you during the first time, we take a nice detailed intake of all your symptoms, and we try to provide longer lasting solutions. So we do that by giving you diet and lifestyle advice. We use a lot of herbs, a lot of nutrients, a lot of homeopathics to basically treat.
Nice. So we work
Yeah.
a lot with nutrition, right? And
Yes.
lifestyle changes.
Yes, lifestyle changes, a lot of micronutrients, because in a lot of cases, for example, just one multivitamin might not cut it for somebody. They might need very specific micronutrients in their diet. So then we might have to see what's deficient, what's not. So we just provide a foundation for the body to kind of start working and healing itself.
Mm-hmm. Yes, I've been receiving this type of medicine for the past 8 years. So I'm happy that I'm not taking any prescription drugs anymore, and I'm not addicted to any dependency of any drug.
Yeah.
So I think that's very good for me. And I have noticed changes, and it's just all about what we eat, how we sleep, and how we feel. And this is what I love about naturopathy medicine. So today, talking about Candida, how do you actually can detect it? That is actually Candida. What are the tests that you run to know if somebody has Candida?
Sure, yeah. So the biggest common one to actually look for is symptomatically, because sometimes it's very obvious. But some ways that if you do want to test it out, there's stool tests. So we do a lot of what's called functional testing, where
Okay.
they're nutritional profiles, but they also tell us, what's going on with your body. It's like a snapshot.
Okay.
So we have stool tests that can test for Candida. We also do certain urine tests that can detect certain constituents or certain. We have certain stool tests that we use that can test for Candida
Yes.
and for different types of bacteria growing in your guts.
Yeah.
So it could be parasites, Candida, bacteria. There's certain urine tests that can pick it up as well.
Okay.
Yeah. So, and otherwise, mostly it's through symptoms that you detected.
So the symptoms could be functional, and so you do the stool test and you also do an urine test.
Yeah. So either or, depending on what's presenting with the patient, that we see what we need to test.
Okay.
But if we're looking at symptoms, I mean, Candida is basically a yeast-like fungus that grows in the body.
Okay.
Everybody has it to a small extent. There's a very nice balance in your body with, good bacteria versus all the bad stuff, right?
Okay.
So what happens is, through certain lifestyle things like stress, or if you have a lot of alcohol, lots of sugar, refined carbs, and if people have like a history of frequent antibiotic use,
Okay.
and just general poor lifestyle, basically what happens is it causes an overgrowth of Candida in your gut. So it's usually there in a normal level, but at this time it becomes an overgrowth.
Okay, so actually if somebody has taken antibiotics, this can actually increase the potential to get an overgrowth of Candida.
Yes, so frequent use of antibiotics and even birth control pills actually can predispose you to developing Candida. So it's all about a balance in your body of good versus bad bugs,
Okay, interesting. So like you saying that this can be affecting more the woman than the man?
Yeah, it's both women and men. But I mean, birth control pills, so women are taking that, so they're predisposed to getting Candida, some of them. But generally, the diet and the lifestyle has a huge impact on this as well. So it could be both women and men. For women, especially as we are having hormonal cycles, certain times, even when the estrogen is peaking in our menstrual cycle, during that time, a lot of women actually experience vaginal itching, for example, and discharge that could also be presenting as Candida symptoms.
Okay, so physical changes. What about like mental changes or something that affects you more in your mood? Is it something that you can see that?
Absolutely. So the very common brain fog, where it's very hard to sort of concentrate and focus on tasks, for example, where you have a feeling that there's just a foggy brain going on. That's one of the classic symptoms that you would see. People with really low energy, a lot of people with chronic sinus congestions, seasonal allergies, and even carb cravings, so cravings for carbohydrates and sweets.
Okay.
And also people with frequent urinary tract infections, for example, and frequent yeast infections. That's a very good sign that something's going on.
So let's say
even body odor too, actually.
If somebody listening to this podcast today and it's like, wow, everything what she's saying, it sounds like I'm feeling it, but I can control it. Like it's not that severe. Is that person should go and test it, do you think? Or it could be just a thyroid problem?
Yeah, there's a lot of different things that you have to look at when you're looking at the body, because there's a lot of different things that can contribute to symptoms. But basically, I mean, let's say, for example, you do check your thyroids or you do check everything on the blood test and everything seems normal, but yet you're presenting with these symptoms and you do have also some digestive concerns, for example. So bloating, indigestion, loose stools, or irritable bowel syndrome. A lot of times there's a Candida overgrowth that's actually leading to that also.
And once the person finds that it is positive, that they have a Candida, how long is the treatment and what is the best treatment to heal this issue?
Yeah, so a lot of times we do look at diet, which is the number one. I'm sure a lot of people know about, the anti-Candida diet that we see online. It can get very strict because you're literally, you're avoiding all caffeine, all sugars, the wheat and dairy products, high refined carbs, and even carbs in general, you want to keep it to a minimum. Yeah. And things like condiments and all that, certain fruits also needs to be avoided. So a lot of it is going to be about diet. You have to choose sort of low sugar foods to eat.
Okay.
But a lot of times, depending on each person, because every person is different, we have to see how severe are their symptoms, because sometimes we use certain herbs as antifungals, basically.
Okay.
Together with the diet and lifestyle changes to help. So there's a lot of antifungal treatments that might be needed at that time.
For the antifungals, I think I could mention some of my favorite ones. I believe coconut oil and garlic. I think those two are like one of the best antifungals. And you can just tell us what are the top 5 antifungals that we can eat easily with nutrition, and if you have another ones for like topical or anything like that.
Yeah, absolutely. So nutritionally, there's a lot of different herbs that we use as antifungals. Again, it all honestly it depends person to person as well. For example, some people can take garlic, but some people it doesn't suit them. So while it's a really, really good antifungal to use, so garlic is really good. Coconut oil extracts like caprylic acid and monolorin.
Which one
That's a
is
really
this?
good monolorin. So it's basically extracted from coconut. It's an active ingredient,
Okay.
and that acts as a very nice sort of antifungal and helps to regulate the gut bugs in there, basically.
And how do you take this one? Like on a tablespoon raw?
Yeah, yeah. So the ones I use, they're little pellets. So depending on patient to patient, we'll start with literally 3 to 5 pellets a day,
Okay.
depending on the sensitivity. Because, when you're killing off Candida, they get very irritated. So when they get irritated, they release their own toxins. So you have to make sure you're detoxing properly as well when you're removing antifungals, all
Okay.
the Candida.
Okay.
So taking things like, coconut oil, garlic, you need to be on probiotics, for example, to help replenish
Any
the good
chains?
bacteria.
Like what chain of probiotics?
So generally, lactobacillus is what you're looking for
Okay.
in
And
a higher amount.
like
So
50?
basically, probiotics, yeah, 25 to 50 billion, but ideally in a multi-strain. So anytime you're seeing probiotic ingredients, the more words of lactobacillus and bifidobacteria you see, the better it is.
Okay.
And also sometimes people with candida, their vitamin B levels and magnesium get depleted. So we have to make sure we're balancing that out.
Vitamin B?
But vitamin Bs and magnesium. So there's a few nutrients that get depleted as well.
What about fermented food?
So fermented food for a lot of people, yes, it's beneficial.
Okay.
But sometimes when people have candida issues, it might actually aggravate it a little bit. So we say temporarily just pause on that.
Okay.
You take it, see how you feel. But sometimes, at least for 3 to 4 weeks, we tend to pause. So other herbs that you can use also is oregano oil,
Oh.
thyme. That's amazing.
Thyme how? Like in food or thyme oil?
Yeah,
or?
thyme, you can actually make tea with it. So you can actually put like dandelion and thyme together and have like 2 to 3 cups a day because dandelion is really good at flushing stuff out.
Okay.
And thyme is a really nice antimicrobial, antifungal. Oregano capsules, they're quite beneficial as well. Again, we said garlic, coconut is also very helpful.
Oh, okay. Any particular Ayurveda that you can, like Ayurveda herb? No? No? What about traditional Chinese medicine? Anything that you can mention from traditional Chinese medicine?
Yeah, so traditional Chinese medicine, basically they use a complex of herbs in there.
Okay.
So they will have a complex of herbs, like they'll put, podarco or tababuya, they'll mix it with milk thistle. So they'll have a very nice killing off the candida plus flushing stuff out. So there's different complexes.
Yeah.
But with Chinese medicine, you have to see what your base constitution is as well.
Yeah.
You don't want to be too aggressive with your body if you're too sensitive.
Yeah. For sure. I mean, but with Candida, I have clients that they try all these treatments and they still have it. They just have a very severe Candida. Do you think there's some cases that they actually have to go and take antibiotics? Is that the only solution?
Well, in really, really severe cases where you can see all the obvious symptoms outside as well, for example, frequent yeast infections or even toenail fungus, white patches in the mouth called oral thrush, sometimes you might need a pharmaceutical antifungal to help with that.
Okay.
So while we're doing that as well, we give our own little antifungal herbs to kind of maintain it also.
Mm-hmm.
And it's a lifestyle. So if you're a person who's prone to getting candida, the best way to try and avoid it also is avoiding those insulin spikes in your diet.
Okay.
So that's where even something like caffeine, it doesn't have any sugar in it, but it basically revs up your body so your blood sugar will increase.
Huh. That's
so
crazy.
That itself can cause candida to start to develop as well.
So you're saying caffeine coming from coffee and even from the green tea too?
General caffeine can be an aggravator.
So any type of caffeine?
Yeah, so it all depends on sensitivities of people.
Wow.
So if somebody, again, is getting candida more often, we have to ask ourselves, are they stressed out? Do we need to balance their stress levels? How is their immune system? What other, thyroid levels as well? Is their hormones regular? because all of these things can predispose to, having this Candida ups and downs, basically.
That's
So
interesting.
that's
So,
yeah, as a person as a whole.
from your experience, how long does it take normal treatment to be efficiently combating this? How long does it take?
Yeah, so I tell all my patients, it's not a band-aid approach that we can work with. So I'd seriously give your body at least 3 months to kind of help start regulate it.
Okay.
Especially if hormones is an issue or something else is an issue together with this, we have to try and balance it out. So it could take longer as well. But, don't expect like a miracle. But definitely within the first few weeks when some of my patients or most of them are doing the diet plus the supplements, within the first few weeks, you'll start noticing a change in your energy levels, your concentration, your sleep. So that's telling us that we're going in the right way.
Interesting. Oh my gosh, there's so much to talk about this.
But I'd say to everybody, really focus on your digestion, focus on all your symptoms, try and see what's causing all of this. If there's nothing outright abnormal that you feel, you need to try and assess to see if Candida could be the one that is contributing to all of this. Even moods like anxiety and depression and all that as well. There's more and more research coming up showing the impact of what's growing in our guts will impact how our mental emotional health is also.
Yeah.
So it's kind of important to catch it.
For sure. Well, I think the most important for me is, from a wellness coaching perspective, is that we are not doctors. You are a doctor. You studied many years on this and you have your practice. So something that I really remind my clients is to find professional advice and not self-advice, right? Many of us, we just go to a YouTube or we go to Dr. Google and we try to find solutions, but we're just assuming, right? So instead of assuming, I will definitely go to a doctor, run the test that I have to run. So in this case, we do stool tests and urine tests, blood tests, anything that can really tell us what's happening with proof. And then from there, run a protocol. So we can run the autoimmune protocol, or we can run any protocol that goes with it, and also have supervision from a doctor like you. I totally recommend this, because if you do it yourself, you exactly don't know what you're doing. And you don't even know if you're curing or you're healing what you really have. So I think that's my main reminder to everybody that is listening, that we're just providing a tool and we're just giving education to people, but we always have to approach to professionals. That's why they exist. So thank you so much, Dr. Shirley.
You're welcome.
It was a great conversation about something that it really needs to be addressed, especially because it's affecting us more and more. So if you know that something like this could be happening to you, so we invite you to come to a naturopath doctor and just test it and do the process. And we wish you the best healing the process if you do the have. And also share this episode with all your friends and whoever you think it will benefit from listening to it. Thank you, Shirley.
Thank you.
Have a beautiful evening there. And we talk in the next episode about what's the next episode. I think you told me what you wanted to talk.
I forgot. Yeah, it's on the list.
Okay. It's fine. We have it there as a secret.
Yes. So stay tuned for next one. Yeah.
Thank you. Well, Shirley, have a beautiful day there. Have an awesome weekend. And remember that together we are stronger.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.